in section 2, we're going to talk about prenatal screening. I already mentioned this word several times when I was talking about women above age 35. And even for any younger ladies, they have to do prenatal screening because it is very important. The most common one is ultrasound. I am betting that all of you guys are very familiar with that because like even if you wouldn't be pregnant, you would do that for like other part of body as well. Ultrasound gonna be any sort of sound waves used to form images of the fetus and the environment. So basically, you wouldn't take any body cell from mom's body or fetus situation, but you can just have some images to get you an idea how the baby is doing. You can do that anytime after week 16 to 20 weeks, because like that week, like that period can give us more information about the sex of baby, about the health of baby, and about the probability of having more than one baby, like multiple, like twins or triplets. With respect to health of baby, we can just monitor, it can't give us much. We can just monitor like head growth, organ defects, or some sort of chromosomal abnormalities, because like from pictures, you cannot get enough, right? You cannot get like a lot of information. But you can just understand, for example, baby's head is just more than a normal baby's head. So you can just assume that maybe the mom should do other ways of prenatal screening as well. Another way and most effective one of the most effective one is amniocentesis. It is like some sort of sampling of amniotic fluid with a needle. So doctor would just use a needle and put the needle through mom's belly, just kind of painful. But yeah, this way they can just screen the abnormalities by measuring levels of alpha fetoprotein, or let's say FEP, and fetal cells. So basically, whenever you are doing that way of sampling, you can get different cells, both mom cells and also baby cells. So you can get some information about like baby's gene or any sort of chromosomal disorder in baby. For example, if the baby would have Down syndrome, you can understand that earlier than 16 weeks. So it might be better and more effective. But there are other ways, another way of that, which can give us information even earlier than the previous one, is chorionic villus sampling, or CVS, in which this is just so similar to amniocentesis, but the only difference is this time they would use a needle and put the needle to cervix to just get more information about placenta and mom cell and baby cell. You can see the picture here, and you can also check this picture with the previous one to just see only the way that the needle gonna go through is just different. There are more procedures, and depend on the problem and situation, doctors would use one of them or like several of them. It just depends. For example, we have endoscopic fetoscopy, which is like kind of new procedure. It is not really new. It is like fiber optic endoscope, and it can just help us to just visualize what's going on with the fetus. Another way is test tube screening, and it is just perfect for parents that prefer IVF as a way to have baby. Here is a video, and this is a short video which can help you to just understand the whole procedure better. If you are a mom, or you want to be a mom, or you want to just work in the same field, I would suggest you to just check this video. So by the end of this section, I want to ask you one question. I want you to actually think about which types of prenatal screening might you choose or suggest to someone. It's a very good question because it can give you an idea about yourself, about your partner, about your family member, and it can also help you to just understand how working as a developmental psychology might look like, because it is all about navigating people, like couples who have problems like infertility, or who have like a baby on the way, which has some sort of abnormalities. We're going to talk about the latter part later, but just answer this question and see you in section 3.